Welcome to the Doctor Connect Show, the home for open conversations where top experts share their experiences and empower you with transformative education around cancer, health, wellness, and medical technology. I'm your host, Dr. Lyudmila Schaefer, medical oncologist. And if you are looking for a better health, global partnership, and want to make a social impact, you've come to the right place. From sacrifice to a celebration and the answers on how to turn your life around. I'm super excited and super pleased to announce that my podcast launched in February, and I'm bringing my years of experiences as medical oncologist to the podcast and television world. Listen, watch, give a rating, and subscribe so you never miss an episode. And if you like our show, subscribe and comment what you like about the show and go to the website, thedoctorconnect.org. Click the button, submit the question. You can either submit your question or if you want to share your medical journey or health wellness story, simply type, I want to share. And we will reach out to you. And if you are in healthcare, join my challenge. Think outside your medical diploma. Whether you are a clinician, researcher, entrepreneur, mentor, working in the industry or leadership, or maybe coaching, we will discuss how to spread awareness of your expertise. And I'm so thrilled because I'm joined today by a very special guest, Dr. Sharon Mclaughlin, a board-certified plastic surgeon. She is also an expert in nutrition and self-care. So stay with us till the end of the episode because you will learn a lot of practical and evidence-based information. Today, our episode is dedicated to colon cancer, nutrition, self-care tips, and much more. In the United States, colorectal cancer is the third leading cause of cancer-related death in men and women. Overall, the lifetime of developing colorectal cancer is about 1 in 23 for men and 1 in 25 for women. The field of geriatric oncology is rapidly growing as the average age of the U.S. population steadily rises and the number of older patients diagnosed with cancer continue to increase. Although the median age at diagnosis is around 70 years old, and 40% of cases diagnosed in patients older than 75, there have been increasing incidence of colon cancer among people younger than 50 years old. I'm Dr. Lyudmila Schaefer, an associate professor of medicine and published board-certified medical oncologist specializing in colorectal cancer. I'm also the clinical researcher of the cutting-edge study to enable earlier detection of returning colorectal tumors. March is a Colorectal Cancer Awareness Month, and I can provide you with clinical guidance tools to prevent colon cancer and essentially things you can do right now. Number 1, avoid the "it won't happen to me" mindset. Many people think of colon cancer as the disease for older males, but this is actually a myth, and it becomes very prevalent in women and the younger population, people under 50 years old. By raising awareness of this cancer and the misinformation surrounding it, we can save people's lives. Number 2, schedule a screening. People don't like to show up their butt, but scheduling a colonoscopy is a very safe and necessary procedure that can literally save your life. The United States Preventive Service Task Force has lowered the age for recommended colorectal cancer screening. Despite the age being 45 years old, we recommend anyone younger than 45 who is experiencing symptoms to get screened as well. Number 3, know your family tree. It is important that people talk to their family and learn their family history. It's not just imperative to know if colon cancer runs in the family, but if you have other cancers in your family, then you can potentially have the gene that can precipitate any kind of cancer related to this gene. Talk to your family, not only to your first degree relatives, but your second and third degree relatives as well, to get a good understanding of your family health history. You have to talk to multiple family members. Number 4, understanding the symptoms. Things like blood in the stool, unintentional weight loss, abdominal pain, change in bowel movement, and pencil-like stool or new diarrhea or constipation are key symptoms of colon cancer. If you experience any of this, it is crucial to call your doctor immediately. If you identify symptoms early, you'll be able to have less invasive, surgery, much faster recovery, less medical bills, and greater chance for long-term survival and normal, healthy life. Number 5, know about clinical trials. Colorectal cancer is unique because treatment doesn't fit all. Just because 2 people diagnosed with colon cancer doesn't mean that they're experiencing the same thing. However, there are promising new advances in colon cancer research, including an active clinical trial to create more personalized treatment. Just because you're diagnosed with colon cancer doesn't mean that you should make premature decisions based on what you've heard from someone else with this disease. Make sure to ask your doctor about molecular test that helps to identify which clinical trial you're eligible for. Connect with me and ask the questions at thedoctorconnect.org. And I'm looking forward to hear your experiences as well as connecting with you. I'm so thrilled because I would like to welcome Dr. Sharon Mclaughlin, a board-certified plastic surgeon with over 29 years of experiences in the medical field. She is a leader and support of the large group that brings women physicians together to network and grow. She has also created a wellness program that offers a whole body approach to weight loss, nutrition, mindset, and self-care. Welcome, Dr. Mclaughlin.
Dr. Schaefer, thank you so much for being here today. I really appreciate you having me, and I love communicating and really talking about health. So thank you so much for what you're doing with the patients out there. This means a lot.
We appreciate to join us today. And Dr. Mclaughlin, can you please tell us a little bit what you do and a little bit about yourself?
Absolutely. So I am a board-certified plastic surgeon. To me, preventative care has been extremely important to me. Self-care has been extremely important to me. I'm a cancer survivor. I had non-Hodgkin's lymphoma. That's why I wanted to go into medicine. And I did that for a number of years. And I found myself really burnt out. I was having a hard time managing the family, managing the career. And I had spent so many years for the career, and I didn't know what to do. I couldn't be a good wife, a good mother, a good physician. So I really took time and really did a lot of self-development, really did a lot of self-care. And when I look back, that's what I was missing, the self-care. So this is something that I'm a big advocate for. And we'll talk about that more in this program. The other thing that I'm also about is bringing communities together. So I'm a founder of a Facebook group called Female Physician Entrepreneurs. And what we do is we bring women physicians together to talk about business. And it's a great networking and a collaborating group. So find your tribe. That's another thing that I'm a big advocate about, finding the tribe that's going to support you. And in return, you support them. But you get much further in life when you're working with other people. So those are the 2 areas.
Yeah, thank you. And as you mentioned about self-care, right now there are so many different resources. And with media and different platforms, the other day I start reading and I don't know where to start. I have to sleep right. I have to eat right. I have to exercise. I have to take care of the family. I have to walk and so many, and meditation and affirmation. And to be honest, Dr. McLaughlin, I got lost. And I thought maybe we can discuss and help little bit community. Where do we start? All families right now at home, a lot of people working from home and some, maybe children at school, maybe not, but we just don't know where to start.
My starting point is always sleep. You'd be surprised what the lack of sleep can do to us mentally, physically. So, number one, we know that it's important to get 7 to 8 hours of sleep. That has to be a priority in your life. It has to be a priority in your children's life, in your family, really. And just get in the habit, going to sleep at a certain time and waking up at a certain time. So, number one, sleep. What happens when we don't get enough sleep? Well, it stresses our body. And I think what happens is that I'm used to sleeping 7 or 8 hours. So when I don't get that, I feel it. But for somebody out there that's not sleeping 7 to 8 hours on a regular basis, like they get by on 5 hours. It's like 5 hours is fine for me. I can get by on 5. But really, unfortunately, the studies will show that increases the risk of chronic disease, some neurological diseases. So we have to be careful about that. In addition, when you're not sleeping 7 to 8 hours, your body is stressed, so the levels of hormone cortisol go up. So what happens when cortisol goes up? We're hungry throughout the day. We crave sugar because our energy levels are low. And we know that sugar and fats and salts all add to extra calories in our diet. And unfortunately, that's going to increase our risk of being overweight or obesity. So number one, sleep. Make sure what happens also when you're sleeping is that there's some rhythms as far as melatonin. You may have heard of melatonin before. It's taken for people to ease their sleep, for them to be able to sleep more. Our bodies actually produce that. But when you're not sleeping these 7 to 8 hours and you're not going to sleep at like 10 o'clock and waking up at 6, if you're going to sleep at 1, 2 in the morning, that normal the melatonin isn't secreted as much. So we're low on melatonin levels. So remember, number one is always sleep. That's what I'm going to start off with. That's my answer for that.
Yeah, no, that's excellent. Actually, I read the research the other day also that we're supposed to go to sleep around the 10 or 11 o'clock in the evening, and that's also prevent cardiovascular disease. So I think it's a lot of aspect. That's wonderful. And you touch a point about weight loss. And, right now, in terms of weight loss, March being Colorectal Cancer Awareness Month. And I just actually read the other day, a new study came by Dr. Berry with University of Maryland that losing weight from early to late adulthood, at least 2 pounds per decade, reduce risk for develop what's called precancer polyps. And these investigators really focus on overweight and obesity. And we also know that it's a lot of other cancers as a risk factor. Can you touch a little bit your expertise about that?
So there's a number of factors. I believe as far as weight loss goes, just the reducing sugar, right? That's a big thing. Fat, you'll hear mixed controversy about. I think there's natural healthy fats, more like the fat that comes in fish, the fat that comes in an avocado. It's different than animal fat as far as I'm concerned. So, and then salt, we know that salt can, that helps retain water, and also blood pressure will change. But that being said, just get more vegetables into your diet. You can saute them. There's so many great recipes out there as far as vegetables go. And I'm not talking the starchy vegetables like potatoes or carrots, although they're good too. They're really the leafy greens. There's so many different, string beans and so many different vegetables that have a lot of fiber in them. So think about the vegetables that grow above ground and try to incorporate them with breakfast, with lunch, with dinner. And you'd be surprised, just filling up on vegetables is going to leave less room for other types of food that may not be as good for you. And I don't really reduce any type of food. I'm okay eating ice cream. I'm okay eating snacks. But think about it, like try to do like 80, 90% of really healthy food, which was mostly vegetables, some beans in there too. And then the other 10%. So just think about that, like proportions. That's a great way to lose weight. So we know, like Dr. Schaefer was saying, that obesity, being overweight, will increase our risk of certain cancers. The fat in our body will actually hold on to estrogen, which will increase some of our risk of other types of cancer, such as breast cancer, and I believe even ovarian and uterine cancer too, colon cancer. So just start, I know you may not want to be on a diet. Nobody wants to be on a diet, right? Because that's very restrictive. Just start changing your habits. Just say, I'm going to get more vegetables into my diet because I know it's important. They don't have to be bland. You can put a little olive oil on them. You can put some garlic on them. I come from an Italian background, so that's, roasted vegetables are really important to me. But no matter what your ethnicity is, there are vegetables in every single culture. So just find out some good recipes that, sauteing, like I mentioned. You may not like fresh vegetables because, it could be a cost. They go bad. I love frozen vegetables. They take so much, they're less time to actually cook up. And they're not, sometimes after, like if I have broccoli or cauliflower, my stomach will actually hurt. It gets bloated. But I find when I eat frozen vegetables, that's not the case. It's probably because it's broken down a little. So just, try to get some frozen vegetables in, see what's on sale, and really think about those vegetables that grow above ground. Water is another thing. Like, it's so basic, but drink water because that also helps flush. It also helps us feel full. So throughout the day, I always have some water with me, and that also helps. So rather than reaching for like beverages that have a lot of sugar in them, extra added calories, stick with some water, put some fruit in it. It could be some apple slices. It can be berries. I love berries and water. And berries are actually a great way to get some fiber and also antioxidants, which can also help reduce cancer as well. So raspberries, blackberries are two of my favorite. You can go with blueberries. They have a little bit more sugar in them, but that's fine. It's better than having candy. Just think about foods that are very colorful, that are whole foods, and you'll be surprised. Just making those changes without actually feeling hungry all the time because you're on a diet can really make an impact as far as weight loss goes and feeling full. And lastly, fiber. Most Americans don't get enough fiber. Hence, we talk about colon cancer this month. Not getting enough fiber will actually increase your chance or your risk of colon cancer. So where do you get fiber? The vegetables. Beans are a great source of fiber, and beans are also a good source of protein as well. We don't necessarily, I'm not pushing for you to be a vegan, but if you get enough fruits and vegetables and beans in your diet, it really can help fill you up, and you're not eating those other types of foods. So remember, beans are a great source of protein, so you don't have to necessarily have animal meat every day. What I try to do is I'll do mostly vegetables, and then I'll garnish with meat. If you think about the typical American diet, it's mostly meat, and then we garnish with a little vegetables on top and try to switch it around.
Yeah, no, that's perfect. And now when you mention about diet, and for the last couple of years, a lot of people changing jobs, and it's not only in medical community, it's so many different communities, and there are so many entrepreneurs. And I actually read about what's called entrepreneur diet, because sometimes we go with our passion and our passion can get on our way. So how do we maintain and how do we keep that schedule that we actually stay healthy, sleep on time, but also, have some other occupation that we normally do?
It's all planning out your week. I sit down on Sunday night and I plan out my week. And then the night before, I plan out my day, the following day. So you have to have some sort of a structure. With that can go meal prep as well. I do my shopping on Sunday. Sometimes I'll cook Sunday night or sometimes on Monday, but I'll make enough food for the week. I also cook, some nights as well. Don't get me wrong, but it helps with like whether you're going to chop and dice and get things ready. You can do what I do is I take big sheet pans and I cook tons of vegetables throughout the week. They're all ready to go. Vegetables, if you're going to cook them, it can be 45 minutes. So if you do that, like line up your oven with 2 or 3 pans of vegetables, they're all ready to go throughout the week. And this way, when you're hungry, rather than getting the bag of chips, right, or some like a candy bar, you can prepare ahead of time. Also having healthy snacks in. And what I mean by that is some nuts, some seeds, and then, not the whole bag. I find out little portions. Either you could buy the smaller portions, or if you find that that's too pricey, just get the big bag and then divide them up in sandwich bags and whatnot. This way, they're all ready to go. You have meals prepped ahead of time, and you're not finding that you're eating like fast food, because that's another problem with Americans as well. Too much fast food in our diet.
Yeah, no, thank you. Dr. McLaughlin, actually, I was also, as you were speaking, I was thinking that you unite so many women physicians, and you are leader on so many aspects. I started reading about you, and to be honest, I didn't even know how to present. There are so many avenues, and through helping other women physicians and in the community, it's almost like a Fibonacci effect, that they're going to teach more people, and it's more teaching more people. So ultimately, be a leader like you are, and, teacher and lead the community. It actually spread beyond one group. So for that, what challenges do you see that maybe we can address for every single citizen that sits at home from the perspective what you are doing? So you are kind of like a holding small group, but then this group teaching so many people. How we can actually, every single citizen, benefit from what you are doing?
Well, as far as like you being at home, there are so many different avenues. I believe community is extremely important, right? If you don't have community, studies show that it will increase your risk of depression, increase your risk of anxiety. So that's important, and that says a lot. So find your tribe, find your community. If you're at home, like with COVID, social media was a great place. Facebook has a group for just about everything. So if you have interest in knitting, if you have an interest in fishing, if you have an interest in drawing, cartoons, painting, no matter what your hobby is, investing, stocks, no matter what your hobby is, you will find a Facebook group for it. So just go into Facebook and the little search bar and just search for the community that you're looking for. And really, that's my biggest advice to you is, we only live one life, right? And if you've ever had cancer, or if you've ever had someone close to you pass away suddenly, that life is short. Like, we know that life is short, and we only have this one life. So make the most of it. Be happy. Sometimes we fill our life with doing. And I'm really about sitting back. Is this working for me? If it's not working for you, then reevaluate and see you're going to have to make some changes. You want to make an impactful life for others, but you can't pour from an empty cup. So if you're not taking care of yourself, if you don't have your tribe, if you don't have a community supporting you, it's really difficult to live that day-to-day life, because we all have bumps in the road. But if you have that supportive community, you'll do fine.
And when you start, community, and, we all lean in toward you, what challenges do you see that, every maybe social situation has when we see, patients and seeing patient in a room? Sometimes it's a simple things, just like as a transportation, or, maybe breakfast, or, pick up family member. What challenges do you see that we are facing most right now if we are not reaching to each other?
Oh, well, you don't have solidarity. You feel by yourself. There's always going to be problems in a group, right? Per se, like there's different personalities, just like with friends and all, and family members. But the bottom line is there's so many other things, like good things that come about connecting, collaborating. When you bring people into your life that are doing things that you want to do, you'd be surprised how much you grow. There's an expression, there's a quote, something like, you are the 5 people you surround yourself with. So are you happy with the people you're surrounding yourself with? Are they supporting you? If not, then maybe it's time just to branch out a little bit more and look at that circle and increase it a bit. I'm not saying to do away with family and friends, that you have right now. Maybe change it up a little bit, go out of your way to meet other people. There is somebody there for everybody, and there's a community there for everybody. So that, that's what I'd have to say, is that community is made up of different people. You're going to just eventually, there may be an issue or whatever, but that's okay. That's life. Bumps in the road. Communication is extremely important, and having what I say, those critical conversations. No one likes to have them for the most part. But communication is extremely important. Otherwise, words go unsaid, or perhaps, there's something going on that you don't realize.
Yeah, no, I absolutely agree. And, social support and finding different communities and actually embrace, because like you said, we want to make sure that everybody knows that, just because they see you and me kind of right now on the screen, the life is not that glamorous. So each of us, I have a certain setbacks, and we really want to share and really want to support. So despite that, if someone has any challenges, please still find your community. Thank you so much, Dr. Mclaughlin. That was so fabulous how you share with us. Can you please share something else that it's in your heart that you would like to share with the audience?
Make time for you. I really believe that if you don't make time for you, nobody else will. And you set a precedent when other people see you give. They just expect it. So make time for you. Self-care is extremely important.
That's wonderful. Thank you. And Dr. Mclaughlin, how is the audience can find you and follow you and connect with you?
My website right there is MindLil. MindLil is an organization, a group that we're putting together as far as putting our mind first and really trying to make our lives calmer than what they are. Taking a lull, taking some period of time for yourself. I'm all about creativity. And when we're go, we're not creative. So just taking time, it really has to do with self-care and really making yourself a priority, and then being able to focus in on what you really want.
Thank you very much. Thank you very much, Dr. Mclaughlin, for being with us. And we will connect with you. And thank you for everything what you do, for your fabulous tips. And we are looking forward seeing you back on our show. Thank you. Thank you for being with us on the Dr. Connect show. Do you have a question, an idea for a topic, or would you like to share your experience or expertise? Go to the website, thedoctorconnect.org. And don't forget to follow up on the social media and join and subscribe my YouTube channel, The Doctor Connect. We are super excited to have you on this journey with us. Thank you for watching and listening, and we are looking forward to seeing you in the next one.